Deep breathing exercises are used to help you improve the function of your lungs by expanding and exercising them after having surgery, going under general anesthesia, or being on bed rest. All of these scenarios tend to interfere with your normal sigh or deep breath mechanism. As a result, the tiny air sacs in your lungs tend to become smaller and less efficient, which may interfere with your recovery. An incentive spirometer is a tool that will encourage you to take deep, effective breaths. This can help to reinflate the air sacs and generate a healthy cough to clear your lungs. Teleflex is proud to offer the Voldine line of incentive spirometers. The Voldine incentive spirometer is the ideal choice for patients requiring postoperative deep breathing exercises. Every unit is individually calibrated and tested, allowing the Voldine incentive spirometer to deliver a reliable measurement of inhaled lung volumes to maximize clinical outcomes. This is your Voldine incentive spirometer. The mouthpiece and tubing connects to the device. Attach blue corrugated tube to port on left side. This is the good, better, best flow indicator, which helps you control the speed that you inhale during deep breathing exercises. This is the inspired volume piston, which rises as you breathe in through the mouthpiece. This is the inspired volume goal marker tab, which reminds you of the goal that has been set by your nurse or therapist. Now it's time to use your incentive spirometer. Sit up as straight as you can, either in your bed, on the side of a bed, or in a chair. Hold the Voldine incentive spirometer in an upright position in front of you at eye level, with the good, better, best indicator facing you. Exhale fully, and then place the mouthpiece in your mouth and seal your lips around it. Inhale slowly and deeply through your mouth, raising the piston up towards the target goal indicator. The flow indicator should remain in the better or best zones throughout your entire breath. If the indicator goes above or below those zones, then this indicates that you are breathing either too slow or too fast. Try to raise the volume piston as high as you can while keeping the flow indicator in the better or best zones. When you get the piston as high as you can, try to hold your breath at the end of the inhalation as prescribed, allowing the volume piston to fall back down to 0. Now rest. Your physician or caregiver will instruct you to take a series of deep breath maneuvers a certain number of times a day. Try to get the volume piston to the target level or higher each time you do the exercise. Your doctor may recommend that you cough at the end of your exercises to help clear your lungs. Remember, the use of the incentive spirometer encourages deep breaths that help re-expand your lungs. Those deep breaths also help you cough more effectively, which may help move secretions up and out of your lungs. Remember to sit up as straight as you can. Inhale slowly and deeply. As the volume piston rises, keep the flow indicator within the better, best zones. Follow the doctor's recommendations for use. Here are some helpful tips. Keep the incentive spirometer close to your bedside. Remind yourself to use your incentive spirometer as prescribed. For instance, if you are on an hourly exercise schedule and are watching TV, do your deep breathing exercises after each hour-long television show. If you have any questions or need additional instruction on the proper use of your incentive spirometer, ask your nurse or therapist. If you are having excessive pain or discomfort while doing these exercises, notify your caregiver immediately. They can determine the best method to address the pain. Teleflex is proud to offer both adult and pediatric size incentive spirometers. The adult version is available in both 5,000 and 2,500 milliliter options, while the pediatric version comes with colorful, child-oriented labeling to facilitate patient evaluation and use. For more information on using your Voldine incentive spirometer, refer to the instructions for use packaged with the device.